This video is regarding the muscle attachments of the humerus. So there are 9 insertions of various muscles, and there are 8 origins of the muscles. So first we will see the insertions. So at the upper end on the lesser tubercle there is insertion of the subscapularis muscle. On the greater tubercle, on the posterior aspect where there are 3 impressions, there are 3 insertions. The first one is the supraspinatus, after that is the infraspinatus and the teres minor. Then on the intertubercular sulcus, on the from medial to the lateral side, that means on the medial lip of the intertubercular sulcus there is insertion of teres major. On the floor of the intertubercular sulcus there is insertion of latissimus dorsi, and on the lateral lip of the intertubercular sulcus there is insertion of the pectoralis major. Then coming to the shaft region, on the deltoid tuberosity, which is present on the anterolateral surface, in the mid of the anterolateral surface, on the deltoid tuberosity there is insertion of deltoid muscle, and similarly on the anteromedial surface, at the same level, there is insertion of the coracobrachialis muscle. So this is about the insertions. Now coming to the origins of the muscle. So on the upper end there is no origin. On the shaft, that is just below the deltoid tuberosity, on the anteromedial and on the anterolateral surfaces, there is entirely the origin of the brachialis muscle. Then along the lateral supracondylar ridge, there is origin of the brachioradialis, which is an extensor muscle, and the extensor carpi radialis, longus muscle just below the brachioradialis. Then there is common extensor origin from the lateral epicondyle. On the medial side, that is medial supracondylar ridge, there is origin of the pronator teres muscle, and there is common flexor origin. Then coming to the posterior surface, on the posterior surface there are 2 origins of the triceps brachii muscle, the medial and the lateral head of the triceps brachii, and along with this there is one more origin on the back side of the lateral epicondyle, that is of the enconeus. So these are the muscle attachments. Now coming to the clinical anatomy, the supracondylar fractures are very common in the humerus when there is a fall on the outstretched hand. But in this supracondylar fracture, there could be injury to the brachial artery also, which can lead to the Bachmann's ischemic contracture. Then there are fractures common at the surgical neck also, which may even damage the axillary nerve. Then in the dislocations of the shoulder, the humeral head usually dislocates inferiorly. Thank you.